my wife is like, hey, "You're tiny now," is what she
Yeah.
says, because I look tiny in the clothes that I used to wear. And I've had observations from coworkers. I'm a musician, so sometimes I'll show up on a job. And most recently, I showed up, and the agent said, "You never were overweight, but you look so much trimmer now. What are you doing?" So I explained to him a little bit about the dietary changes, especially the food chart that Claire supplied, and that I have to mention that that's a big component of this, obviously. Even the muscle gain, I believe, because I did increase my protein uptake intake at that time as well. For example, I mean, I do food prep now a day or two out of the week, and it's just easier. You come in, you're hungry, and there's no junk in the refrigerator to grab. So there's all
Yeah.
healthy stuff in there, and it's just I feel better after. There's not this crash from sugar or whatever. I still drink coffee, but the sugar, I thought I would really miss it, and I was eating bagels like crazy before I came to your practice, and then I stopped eating that, seeing what the food chart recommended, and I think a lot of that, that stuff it's really fattening. It was for me. Well, the first experience was as thorough as anything I've ever experienced, as far as let's get to looking at your veins and looking at what's going on. For example, you ordered a carotid echocardiogram and an echocardiogram of the heart, and through that I was discovered that I had some medium blockage, I think is as you described it. Nobody's ever suggested that I take that test, and I'm so glad that I took it because it gives me some insight as to what's really going on. I am concerned about heart disease because it runs in my family. My grandmother had a stroke, and it's just on both sides. So I would like to I wanted to get I wanted to get a jump on it if possible, and you were the guy that I ended up in front of, and I'm really glad I showed up for you. Trust the team you have in place, from your recommendations medically, to the nutrition, everything, the complete system, I believe, is what makes it successful. The numbers say that I've lost 20 pounds of fat, which I just didn't even know I had, but you would know it because I was a 36 waist, and now I'm a 32 waist.
Wow.
So
Wow.
I'm spending a lot of money on clothes, is what I'm saying here.
Yeah.